Hello, I'm Brandon from Harmony Dental. Just wanted to take a few minutes to go over the implant process. So an implant is for people that have been missing teeth. Some people are born without teeth. Some people got into an accident. Some people just had a root canal that failed. Some people had a really bad cavity and just could not afford at the time to get a root canal or an implant placed. Implants have been around for a long time. I've been in the dental field for about 14 years, and they've been doing implants since I first got in this field. Now, a lot of people are very scared of an implant. I'd be scared too. They're pretty big. I mean, look at that guy. That's as big as my thumb. They just screw. No, I'm just kidding, guys. This is actually just a model of an implant. This is huge. This would be an implant for a dinosaur, okay, or an elephant. Okay, this is huge. This is actually the implant, and this is an abutment. Okay, what they do is they screw together, and you can then put a tooth on top like so. Okay, and this replaces everything from a cavity that was in a tooth that a tooth had to get taken out. If you got in an accident, if you had a failed root canal, if you were born without a tooth, and you had braces and now you got a hole in your smile and you want to put a tooth in there, this is the best option. It does not destroy any of the teeth on the other sides of them. It simply replaces the teeth you are missing. It's very easy to do. It's very painless. I have thousands of reviews on the website for the doctors that I work for that place these implants. 99.9% of the time, people tell me they did not even have to take the pain medication the next day. Now, this is when people have already been missing a tooth. Some of y'all have had to have a wisdom tooth pulled, some kind of tooth pulled, and taking your teeth out. Sometimes you are going to have soreness, and it can be a lot of soreness, and sometimes it can be very, very minimal. But everybody is different. So, I just actually want to show you. Now, this was a model. I was just joking. This is huge. Again, this is huge. This is the actual size of an implant. No, we would not place this implant in somebody else's mouth. This is just to show you, okay? All implants come super sterile. They can't even be touched by skin. They have to be super, super sterile, okay? So this is just an implant, an actual size of one of the largest implants you could probably get. Okay, so this thing is super, super small. Okay, I wish I had something to compare it to here, but let's see. So here we go. Here's a pencil. Okay, you can see that this thing is so small. Okay, I've had M&Ms bigger than this thing. This thing is super small. Okay, so basically, what happens is there's 3 parts in the implant. You have the implant itself, then you have what they call an abutment, and then you have the third part, which is a crown. A crown is a dental term for the tooth. Okay, we like to use very top quality crowns. We use high noble metals, PFM, or we'll use what they call zirconia or Bruxer. That is a crown with no metal at all. The ones that are zirconia come out to a very natural look, as best as possible. They're very not noticeable for an implant crown. Okay, so what happens is the doctor places the implant in the missing tooth, okay, sits in there for about 4 months, okay. In the meantime of you missing the tooth, what you'll wear is a little flipper, okay, and that just has one little tooth on it. You can see it right there, just one small tooth. This replaces that missing tooth in your smile. So imagine if I was missing this tooth. I would wear this while this would be inside the bone, healing for 4 months. Now the bone will actually grow around these little threads in the implant. You can see them here. They're not very clear, sorry, but you can kind of make that out. There's little threads, just like a screw, okay? So the bone will actually grow around these little threads, and it'll lock the implant into place. This is a very high quality implant. This is titanium. It's a surgical precious metal that they use for everything that they have to use in any human body. That's your joint, your knee, screws if you broke your back. This is the same type of screw. There is absolutely no difference besides the attachments on what we put the tooth on. So that's a little bit different, but another video for that, okay? So we put the implant in, you wear the little flipper 4 months, then you come back out, we throw this thing away, or I make it into a really cool little necklace for you, whatever you like to do. Then we place in the custom abutment. Okay, this part actually screws into the implant like this, okay? And then we actually just make the crown, and the crown just sits on top of the implant. It just sits on the abutment here, okay? This is super small, it's hard to handle, but it just basically fits into the abutment, and you wear the tooth that sits on top of the implant, and it bolts down. Now this tooth will never get a cavity no matter what you do to it. This should last you the rest of your life. Okay, so I'd like to introduce to you my friend here, and you can see this is him here, okay? He's gonna help show us what an actual implant looks like, okay? So here you go. They drill down into the bone. Well, it's not really drilling in the bone, because you got to remember, you had a root here, okay? And maybe you can see it a little bit closer, but look at the size of this root, okay? Or for example, here's the root. You see this is the bone, and you can see the root right here, and look at the tooth, and look at the implant compared to this. Now, when they take out a tooth, that hole, which we call a socket, is the same size as this implant. Okay, can you see that? Can you see real clear? So you see the root versus the implant, it's very similar in size. So what that allows us to do is simply just put the implant in that socket and let Mother Nature, the bone, grow back around, and the implant heals into place, and then we can place the tooth. Okay, and you can see this guy here, he had to have a sinus lift done, he had some implants here, he had a root canal. He probably had a root canal here, and it failed, so we put an implant in for him. Okay? But that's exactly what it looks like. Pretty easy to do. And I just want to really make that clear, okay, that you can see that implant is about the same size of the root. So if you think about it, if I already had a tooth here, okay, and I pull it out, and then I place in an implant the same exact size, how can that really be super painful? Screwing in the bone. I know that freaks you out. I know you've gone on YouTube and you've watched these videos and they explained all these things and you've seen things. Well, that's one of the worst things you could do. First of all, you're numb. If you're nervous, we got nitrous here. We have conscious sedation. We can give you pills where you just don't remember anything. You'll have a wonderful time. You'll sing a bunch of songs. Your family will take videos of you and probably post them on Facebook. But you'll get what you need done, and you don't have to be stressed out about having a very small surgery. These surgeries, when we place implants, my doctor takes maybe 20 minutes to put an implant in. It is a very fast, pretty easy surgery. You always have that one person that's a big wimp, that's me, you know, gets a shot, I'm like, ow, just like everybody else. But it's not got to be like that. It's worth 20 minutes of your time to have a tooth back, to have a great smile again, feel confident about yourself, not have to wear that silly little thing that you're wearing right now that keeps falling out on you, rubs your tongue raw, makes you have a lisp, food gets stuck in it all the time. Every time you go out to dinner, this thing gets food stuck under it. It's just bothering you. You can't wait to get out of that restaurant just so you could rinse this thing off. Okay? You don't have to wait anymore. Implants here are only $1,899. I can finance you out 2 years, no interest with Care Credit. Okay? All you need is about a 620 credit score. That's about $75 a month to replace that tooth. Okay? If you Google how much does an implant cost, total cost, crown, abutment, everything, it is $4,500 on the minimum price you can find in Houston for just one tooth. That is really, really crazy. Okay, implants don't take that long. We don't try to make an arm and a leg and make a fortune off you of every implant. We try to treat everybody like family. We want to give you the best service. We want to stand behind our work, and we want you to bring your family, your friends, your coworkers to us. That's how you give us the biggest compliment. Okay? If you don't believe me, go on Facebook, read the reviews from Harmony Dental Pearland, Harmony Dental Pasadena. Look at all the patients that have gone through this, that have wrote good things. Do you know how hard it is to get somebody to write something good about your business? Write something good that happened to them on Facebook? Everybody will go and write a bad comment in a heartbeat if they did not like something. They will bash you, okay? But when you have 5 stars like us, you have 1,000 reviews, everybody leaves here happy, okay? Everybody gets a great deal. They have nothing to complain about. Okay, we have a beautiful office. We have 2 beautiful offices. We're doing something good here if we have 2 offices, okay? Each office has 14 chairs. We have hygienists, we have assistants, we have doctors, orthodontists, we have surgeons. We have everything you need in this one building, okay? We can do everything here. We have our own lab. A lot of our stuff is made here in the office, so we don't have to send anything out. This cuts down on a little bit of the wait time, which there's always wait time. That's the one bad thing. But while you're missing the tooth, you'll have something temporarily. We really do not let people leave here missing a tooth under some circumstances. We want to get you a tooth in as fast as possible, as fast as Mother Nature and science will let us. So if you have any questions, please like, share this video. You probably have somebody in your family that's missing a tooth, that has been waiting for a long time, running around, just front tooth missing. Now's the chance they can get another one in. If your credit's bad, don't be scared. You can pay half down. You can pay half when you finish. We will work with you. We want to get your tooth in. We want to give you a beautiful smile. Call us at Harmony Dental. Facebook, write us. My personal cell phone is 832-705-3321. Feel free to send me a text. I like my job. I'm here to help you. Text me anytime you need me. Thanks.